Hi guys! Actually, today we will talk about cholesterol, which is very important. If you are in the United States, here we have a lot of eggs in any way. Scrambled eggs, Benedict eggs, omelette. And then generally when you go out for eating, people use a lot butter, which is not so common in our cooking. In Italy, we don't use butter so much as here in the US, or if you go abroad, even if you go in the north of Europe, for example. So if you are an Italian abroad, even in this case, or in general, if you live in this culture, the cardiovascular risk is higher. And how to understand which is your cardiovascular risk, it is very important to monitor the levels of cholesterol. There are different types of cholesterols because cholesterol in any case is very important also for our functions because it's part of many cells' tasks. So we need part of cholesterol. The important thing is to monitor how much. We have different types of cholesterol. We have low density lipoprotein, LDL, which are the bad one that increase the cardiovascular risk. And then we have HDL, that is high density lipoprotein. They are the good ones. And we need this kind of cholesterol in order to give to our cells the ability to perform some functions. And then we have triglycerides. And generally in this test, we have also the total cholesterol levels. It is very important to keep in mind that we have to do this test. I mean, the correct way would be like at least twice a year. Or if you are taking a specific medicine, like statins, for example, in this case, it is useful to do them also to understand if the therapy we are doing is actually working or not. Especially also to understand if there are some cases where there are some side effects with these therapies. You can feel muscle pains, for example, and it is important to understand if the therapy is worth or not. So keep in mind, they are not invasive tests, and 2 times a week are fine. A year, sorry, are fine. And then keep in mind nutrition, that's also a very important aspect. And if you are at home especially, try to decrease the use of dairies and eggs, like twice a week is fine, but not like every day. If you have more questions,